5 minutes to the top of the hour here. Health officials are saying there's a sweeping spread of whooping cough cases across the country. The CDC reporting there's between 6 times more cases this year compared to last. Officials expect that number to go up in both vaccinated and unvaccinated people as we return to more typical infection patterns after the pandemic. Joining me now, I have Dr. Renee Matthews, who specializes in asthma and allergies. Good morning. Thank you so much for being with me.
No, thank you for having me.
In person. So the CDC reporting these cases are coming in at levels we haven't seen in a decade.
Yes.
How worried should we be about this? Are you on edge?
We should
as a
be
doctor?
very worried. One, because I'm an asthmatic, but yeah,
Yeah.
we should definitely be on edge because we've just never seen such numbers like this in a long time. But it's because, the vaccines, you get your vaccines as kids and then you just forget about it. And we need to go back and get some boosters and then we had a lot of people that weren't vaccinated over the pandemic because they missed doctor's appointments or then once they got out of the pandemic, they were afraid of vaccinations for whatever reason.
Yeah.
So, yeah.
You and I were talking just in commercial break. You had a friend who just called
Yes.
you and said, I have whooping cough. What is it exactly? What symptoms should be on the lookout for to know that this isn't just the seasonal crud?
Sounds like a common cold at the beginning, but then it has that whoop sound when you inhale, and that's what makes it the difference. And you're going to cough for weeks. So if weeks. So if
torturous.
Yes. So, and I mean, coughing into possible vomiting and, so it really can be bad and it can be deadly for some people, especially immunocompromised people, like I said, myself with asthma. So it's really important that if you notice something, please go to the doctor because there are antibiotics that can nip it in the bud, hopefully early on. And also it's very, it's going to spread. So you want to make sure you get something on board so that you're not spreading it to everybody else.
Yeah. And tell me about the vaccines because, we haven't thought about whooping cough in so long. I have a 7-month-old at home. Is there a baby vaccine? And are we as adults just able to call the local pharmacy and say, hey, can I stop by or what should we do?
So the vaccines, the CDC has a protocol for infants, but the best thing is moms in the 3rd trimester to make sure that they get their vaccine because that will cover the baby until they're eligible to get theirs. And there's 5 shots in the first vaccine, the DTaP, and then for the children that are like 7, 8, there's 1 shot. And then after that, you're supposed to get them every 10 years. So adults also.
Okay, so I'm good. I had the DTaP in 3rd trimester.
Yes.
Okay.
Yeah.
And then if you or someone you know has whooping cough within your family, how do you manage that in one household?
Masks.
Hand washing?
Hand washing and masks.
Okay.
Yeah.
Okay.
Yeah.
Well, Dr. Renee Matthews, thank you so much for your time, your expertise this morning, and thanks for being here in person.
No problem.
Happy New Year.
Happy
to
New
you
Year
and
to
your
you too.
family.